very, very beginning and to tell our audience exactly what is HIV and AIDS. And I know you've said it time and time again,
Okay.
but give us the causes of it. You see,
Okay, HIV stands for Human Immunodeficiency Virus. This is the virus which causes AIDS, and AIDS is acquired immune deficiency syndrome. Now, there are three ways in which a person gets infected with HIV. That's unprotected sex with an infected partner, blood to blood, and that most commonly occurs by sharing needles. And we're talking any type of needles. I know most people associate sharing needles with injection drug use, but we're talking body piercing, which is a fad now that we know. And especially in our community, we have Tattoo John, Tattoo Wayne, and Tattoo whoever. And they can get HIV that way. And the only other way is mother to child. You can be born with it. Those are the only three ways you can get it. Then you have four body fluids which transmit HIV, which is semen, breast milk, blood, and vaginal fluids. And you have to get one of those fluids of an infected person into your body. Those are the only ways you can get it.
And so there's no casual contact or anything?
Absolutely not. You don't have to worry about it, getting it by drinking after somebody or shaking their hand, giving them a hug, or none of that. Those three ways I mentioned earlier, it's the only three ways. And in those four body fluids, it's the only body fluids which can transmit the virus.
Now, this disease, Ms. Crowder, has had a devastating impact upon the healthcare system, upon individuals, and etc. Let's talk about the impact that this disease has had upon these various elements.
Okay, I mean, we know that with TennCare, I'm thinking that it has a very devastating impact upon the healthcare system, and we can talk about that a little bit more after the commercial break, because I know it's time for a commercial break.
And you know that I don't have any problems interrupting you with it,
Okay.
But we are scheduled to come up for one within the next few seconds. And when we come back, we do want you to talk about some of the impact that this disease is having upon individuals as well as upon the healthcare system. That'll give us about 8 minutes to deal with that as an issue.
Okay.
Of course, we'll be back with our audience following this very, very short commercial break. The topic is